participants on the line. So I'd like to welcome you to this Cole County press briefing. It's been a little while since we've done a briefing like this, and we thought it was a good opportunity to get everyone together and share some vital information for our community. So I would ask it, if you're not speaking, to go ahead and put your phone on your Zoom on mute. And so again, I would like to welcome you. I am Christy Campbell. I'm the director here at the Cole County Health Department. We'll start with an update from the hospitals so they can share their current status and, of course, their testing and their vaccination services as well, because that is exactly one of the pieces of information that we would like to get out today. So Dr. Haight with Capital Region Medical Center.
Thank you, Christy. This morning we had 29 patients who have had COVID, of which 23 are in isolation, and we have many of those that are on the ventilator for respiratory support. The entire hospital is full, and so we are making arrangements and moving things around to be able to expand our ICU into other areas of the hospital, as well as our step-down unit. This is a combination of things. So our COVID is putting a stress on our number of ICU beds that are being utilized. In addition, we're seeing a larger number of patients with what we would say are routine health issues coming in as well. If we remember back a year ago in the fall, many people were not seeking care even when they should have. Well, the good thing is they are now seeking care, but it does put further stressors. So again, we want people to seek care, but it is filling up, I think, all of the hospitals in our area. With respect to vaccination, we are currently offering vaccinations at all of our clinic sites, as well as our 2 pharmacies. We have a Capital Care Pharmacy on the Madison campus in our physician office building, as well as our pharmacy in Versailles. But as patients come into our clinic or into the hospital, they are being asked if they've been vaccinated and would they like a vaccine. For those who are visiting our pharmacy or need a vaccine, again, we have that available. With respect to testing, all of our primary care physicians have access and are able to test in their clinics, and so we are recommending, instead of going to the emergency room or to urgent care, to contact their primary care physician for testing. Certainly, if someone is severely ill, then they would need to go to the emergency room. So that is what we are doing for testing. We also have a triage line, and I think Christy may have that information. I don't have that in front of me. For those patients who do not have an established relationship with a physician or provider, then we have that line open for certain time during the day, and we do testing Monday through Friday. So again, I can look for that information if Christy doesn't have that readily available.
Thank you, Dr. Haight. I don't have it right on available, but we have put together a 1-page flyer that has all of the testing and vaccination locations in Cole County. That should be finalized today, and then I will send it out to all of the organizations on this call so they can post that information and have it available for people if they have any questions about locations for testing or vaccines. Dr. Haight, I appreciate you giving us the update about the status of your hospital. I think we have had a lot of questions about people hearing that the hospitals were full, and I'm glad that you were able to provide the information about COVID patients versus non-COVID patients. And I did have a question come into me about asking why the hospitals were full at this time of year. And I think that you sort of clarified that there have been some patients that didn't seek care in the last year for whatever reason, and that might be contributing to the issue of your census being higher. Is that correct?
That is correct. And so in addition to that is people are coming into the hospital with good reason to come to the hospital. and they're not as afraid of COVID because they may have been vaccinated, and so they're coming in appropriately when they're having heart attacks or strokes or having different things. So it's a combination of things of why the hospital is full at this time.
Thank you for that clarification. Dr. Adams with SSM St. Mary's.
Good afternoon. Thanks, Christine. I agree with many of the things Dr. Haight already highlighted. You will find that all of our outpatient clinics are both doing testing and vaccinations as well for the St. Mary's Medical Group. And we also have urgent cares available for those who need something urgently and cannot, perhaps they don't have a PCP, as Dr. Haight already mentioned, that could occur. And I also would like to reiterate that if you have non-urgent questions related to potentially having COVID, but it's not an emergency or urgency, that you seek care in the primary care outpatient clinics because our emergency rooms are seeing much more volume of patients than they are typically seeing this time of year. Similar to Capital Region, St. Mary's also has a lot of patients presenting for care. Due to the increase in demand for healthcare that we saw, we did add on more than 24 staff this past week, and they are all onboarded and working in their locations that they were hired to work in. And so that has a welcome relief for the rest of the staff who were really working really heavy loads prior to adding those more than 24 staff on. We still are planning to recruit and hire an additional at least 20 more staff in anticipation of a likely continued surge in the Mid-Missouri area. So that's all. Thanks, Christy.
Thank you, Dr. Adams. Can you provide an update on the COVID patient numbers in your hospital today, or do you have an accurate count?
Morning, we had 23 COVID patients. 13 of them were off of isolation, so no longer viremic, so they were able to be taken off of isolation, and 6 of them are ventilated in the ICU.
Thank you for that update. Ron with Jefferson City Medical Group.
Good afternoon. So JCMG continues to provide both vaccinations and COVID testing within our clinics. At our main location here on West Stadium, you can receive a COVID vaccine, any of the 3, from 8 a.m. to 4:30 p.m. We can take walk-ins, established patients, new patients. We can also get you scheduled online if you're wanting to reserve a spot. As far as testing, we've got 2 locations primarily here in Jeff City, our Express Care Stadium and our Express Care Elm, both of which are able to offer the rapid PCR test. We do want to stress, similarly to some of the ERs, we are experiencing high volumes in our Express Cares as well. So your wait time may be extended or delayed more than normal. So just keep that in mind. Again, additional options to book online and seek those resources can be found online at jcmg.org. Of course, we contend that immunization remains the biggest tool in our toolbox to fight this disease. Of course, we also don't want to forget, though, other practical means in terms of social distancing, good hand hygiene, wearing a mask if you're indoors, and then, of course, staying home if you're sick. Thank you.
Thank you, Ron. County Commissioner Sam Bushman.
Yeah, thank you, Christy. I just want to say at this time, Cole County has no intention of imposing a mask mandate or ordinance. And we rely on the intelligence of our citizens of Cole County to know when they feel they should wear a mask and when they don't need to wear a mask. So that's all I want to say.
Thanks, Sam. I know that that has been a question of late. I'm glad that you answered that for us. We have seen an increase in cases lately. We've also seen an increase in vaccinations. And like I said, we will send out that flyer that shows all of the testing and vaccination locations so everyone knows exactly where to go. The other thing that I really wanted to stress today is we're hearing about other illnesses, and we know that the incidence of RSV has been increasing with kids and lots of other respiratory infections. I wanted to emphasize immune system health. This is still a good time for you to exercise, make sure you're drinking plenty of water, and increase your vitamin intake. We are seeing more and more research lately about vitamin D deficiency and the severity of COVID illness. And so it is a good time to stress to everyone that they should be increasing their intake of vitamin D, vitamin C, and zinc. All those things are very good for your immune system health, and they should help you whether you come into contact with someone who has COVID or other respiratory illness. And it's not an either or. I know that the governor shared with me that they were having a discussion about someone saying, well, you know, would people rather take a vitamin or take a vaccine? It's not about an either or. Everyone should be doing everything they can to boost their immune system and to be ready to fight those viruses that they come into contact with. So at this time, I would be happy to entertain any questions, or we could open it up to the panel for any discussion if there are any questions from the group.
Hi, Christy, I'll ask a question. We're just a few days away from all the bicentennial celebrations. Are there any sort of specifically new precautions that Cole County is going to put in place, or are there any expectations that may come from? Are we going to see a spike in cases following the bicentennial celebration?
Honestly, the Department of Health and Senior Services has been handling all the recommendations and meeting with, I assume, the governor's office about the precautions for that. They have not consulted the Cole County Health Department about any recommendations that we would have in place. I would hope that most of the celebrations will be taking place outside, so I would anticipate that we would not see an increase in cases. But honestly, they have not consulted with us about those celebrations. Sam might be able to speak on what the county level celebration is, but we have not been involved in the planning for the statewide celebrations.
Yeah, I just know Monday afternoon at 2, they will be dedicating the bridge. And then I think at 8:45 on Tuesday, they have the ceremony, but it's outside. So I think, you know, if people will kind of, you know, socially distance as much as they can, I think you're probably pretty safe. But I plan on being there. So, but it is all outdoors.
Thank you. Any other questions?
Yes, just one, I know the school's starting soon, and I know the Delta variant does affect kids more than previously. Just wondering how the outreach and vaccination of eligible children is going. This is my question.
Sure. So we have been meeting with the schools almost weekly or every other week for some time now. We've been working with them to develop, I apologize, my phone's ringing, to develop guidelines for them to go back. And we've been talking about issues such as immunizations, but we are going to develop a guideline that will take into effect the community spread and also what's going on in their school. And they will have recommendations they can follow to keep the kids safe. I know that the Community Health Center, Dr. Sullivan was not able to be on the call today, but they always go to some of the Jefferson City School District's registration events and offer the vaccines that like 8th graders need, like meningococcal and Tdap. So this year they're also offering the COVID vaccine there. They're also, they're taking the mobile unit that was purchased by the County Cares funding. So they're also going to Helias, and I think Calvary Lutheran, and perhaps one or two other schools. So rest assured that we have a very close relationship with the schools, and when we have been talking about vaccination for them. In fact, some of the school representatives are on the call. I see their names, so they can attest that we are working together and we are doing everything we can to make vaccinations available for those eligible school-age children.
Thank you. Hopefully we're not seeing hospitalizations of children, but I guess I'm curious as whether we're seeing any of those.
Dr. Haight, I think you're on mute.
Thank you. Sorry, at Capital Region, we're not admitting pediatric patients. We're actually sending them up to women's and children. And again, they will say, I think that they have a mixture of some COVID, but they are certainly having a lot of RSV right now.
Likewise, we're seeing mostly other viruses more predominantly, but I will say that SSM Cardinal Glennon is seeing some COVID admissions in St. Louis.
Thank you. Are there any other questions at this time?
I did want to mention as well, Christy, an adjunct to the other question about the immunizations. The Jefferson City Parks and Rec is holding their back to school event on August the 14th, and the Community Health Center will be there as well with a mobile unit providing immunizations to both children that meet the criteria as well as any other parents or guardians that might be with them at that time. So just another opportunity in which trying to provide as much access to immunizations as possible.
That's right, Ron. Thanks for that reminder. And also, several staff from all the organizations will be at Lincoln University on August 11th to do vaccinations. So lots of vaccination efforts going on in our community that touch school age or college age children. I
And
guess I should say college age children, college age.
And I'll just remind everyone, we have a group that's been meeting since November to go over vaccinations, and that continues. We continue to meet every week, and that includes not only Cole County, but other counties within Region F to make sure that everyone has vaccine that they need to. So we are moving vaccine around so that when events are being held and we're asked or we have volunteered to be a part, that we have vaccine available.
That's right. It's a really good weekly meeting just to touch base about vaccines. So are there any other questions? Okay, well, hearing none, please know that I will be sending out that flyer. We'll also post it on our website along with the other groups. And if you have any questions in the meantime, just let us know. Thank you, everyone. Have a good day.